Now look at this question that has been asked in anatomy final exam. Types of anastomosis with suitable examples. Okay, they've asked for just 3 marks, so let's not spend much time on this. The types of anastomosis with suitable examples asked in recent question paper. Okay, theory, final exam. So first of all, what is anastomosis? It is a communication between vessels, correct? It is a communication between vessels. So what type of communication? The blood flow, okay, between vessels. Vessels means what? Blood vessels here. Okay, so that's what you will say. What is anastomosis definition? You will say, according to textbook, it is pre-capillary or post-capillary communication between neighboring blood vessels is called as anastomosis. Okay, now if there is some circulation happening through this anastomosis, it is called as what? Collateral circulation. Collateral, that means something extra, collateral. Okay, so now let us say there is a blood supply here. There's one blood supply here and there's one more blood supply here. Okay, now there is some communication between these two that forms. A new blood vessel has formed between these two for whatever reasons, physiological, pathological, that they didn't say. Okay, now there is some blood vessel which has formed here. So this is what? Anastomosis. Very good. So it's a communication between neighboring blood vessels. This word is important. You can't go and form some communication between somebody who is not your neighbor, right? Between neighbors only you will form. So this is anastomosis. What is the circulation? If blood flows through this anastomosis, collateral circulation. Okay, if it is arteries between which it is happening, collateral arterial circulation, like that you can say. Okay, so you got it right. Now this thing, this anastomosis, it can be physiological, pathological, etc. that they have not mentioned. Okay, so sometimes what will happen if there is a block in this vessel, okay, then it may try to, the body, it may try to form an anastomosis here and try to get the blood from there if it is a artery, or towards that if it is a vein. You got it right? So basically some communication, it is some what is this, collateral circulation is going to happen. Okay, then what are the types of anastomosis they've asked? This is just a 3 marks question, so we'll just write it is going to be arterial anastomosis, right? I actually told you between arteries it can happen, or it can happen between veins, venous anastomosis, or it can happen between artery and vein, then it will be arteriovenous anastomosis or a shunt. Shunt word is what? Shunt word is used for arteriovenous anastomosis. They've asked for examples. They've asked types and examples, so we have to write more. Example also we have to write. Now again in this arterial, no, focus people, under arterial again you have 2 types. You have actual and potential. So actual means, what are they saying? The arteries meet end to end, something like this. Like this, there's one, and then there's one like this. End to end they are anastomosing somewhere here. End to end anastomosis is happening. That is actual. This is actual. Where will you see this? In palmar arch, plantar arch, circle of Willis, intestinal arcades, labial branches of facial arteries. So we are talking only about arteries. What is this palmar arch? I will explain so that you will understand the concept at least. So basically, if this is your, you tell me what this is, okay? What do you think this is? Yes, it's the right hand, right palm. Yes. So here you have the arch. Which arch is this? Superficial palmar arch. So this is ulnar artery and this is radial artery. This is the superficial palmar arch. Okay. Under this you have one deep palmar arch. What do you have? Deep palmar arch. Between these two there are anastomoses. I'm using blue. No, I shouldn't use blue. Let's use some other color. So there is some anastomose end to end between these two. Okay, this is called as what? Actual arterial anastomosis, because the arteries meet end to end. Okay, where is it? Palmar arch. Whenever you say palmar, one same thing like plantar will be there. right? Then you have circle of Willis, that is in your brain, circle of Willis. So end-to-end anastomosis you have between these arteries. So example only they are asking. So palmar arch, plantar arch, circle of Willis, then other things you can write. Okay. Then coming to potential arterial anastomosis means what? Okay, potential arterial anastomosis means it is at the terminal arterioles. Let me explain this to you. Okay, so basically here there's an artery, okay, like this. From this you have branches, okay. From these arteries you have some arterioles which are terminal, okay. Between these arterioles, terminal arterioles, you have an anastomosis. So this is a potential arterial anastomosis. So this potential arterial anastomosis is between what? Between, come on, say it, terminal arterioles. So now let us say the occlusion here is in the main artery. Then this anastomosis is not going to help at all. Correct? So basically, this is, where will you see this type of anastomosis? You will see it in locations like the heart and the brain. So if main occlusion is there, these will not help. Okay, so this is potential. Go back here. Potential arterial anastomosis. It's the communication between terminal arterioles. So these can dilate only gradually for collateral circulation. Sudden occlusion of main artery, these anastomosis will fail to compensate the loss. So where will you see this? Coronary arteries and cerebral arteries. Okay. Now let us go to the next type of anastomosis, venous anastomosis. So venous anastomosis is communication between the veins and tributaries of the veins. Okay, so you can between veins. So we have to use everything blue here. So let me use this blue color. So this is going to be your venous anastomosis. So when the blood has to drain like this, like this, like this, it's draining towards your heart, let us say, right? It can also drain like this through the venous anastomosis. And finally, where is it all going? To your heart, which is going to take all this blood and send it to the lung for oxygenation, correct? So it is zooming a lot, but remember, finally, the veins have to drain where? Into your heart. So venous anastomosis is a communication between veins or the tributaries of vein. Where will you find this? In the dorsal venous arches of hand and foot. They're talking about hand and foot. So let's draw a human here so that you won't forget. So here's a human, right? And here they're talking about the hand and foot. See, I want to tell you clearly, they're talking about the hand and foot. Very distal portions only they're talking about. So your foot is here, okay? They're not talking about upper limb and lower limb. I'm trying to be very clear on that. They're not talking about upper limb and lower limb. They're talking about hand and foot as the examples, okay? Dorsal venous arch, okay? So we are done with venous anastomosis. Next we'll go to shunt. Shunt is what? Arteriovenous anastomosis, okay? So basically this is communication between artery and vein. This one is a little hard to understand if God is making it. Why is God creating this kind of shunt between deoxygenated blood and oxygenated blood? Why is he creating the shunt? So this is something that happens when the organ is not in function. See, the example that the textbook gives is that if there is an organ here, for some organ is there here, okay? So there's some organ here, okay? Organ, okay? Now there is an artery, right? And there is a vein. Sorry, vein. There's a vein. Between these two, there is a shunt. We are calling it a shunt, okay? So this will be used only when this organ is not working. Okay, when the organ is working, the shunt won't be used. So basically when the organ is at rest, what will happen? The organ wants to rest, right? So what will it do with all the blood? The blood bypasses and the shunt is used, okay? So this shunt may be straight or coiled. It may possess muscular coat and it will be under the influence of sympathetic system. So this is something that you want to understand now. So here you have the artery and the vein. Here there is a shunt, and this one they are saying will have what? Muscular coat. Okay, it can be straight or coiled and it is under the activity of sympathetic nervous system. Okay, so this is how the shunt is there explaining. Okay, the shunt vessel may be straight or coiled, possess a thick muscular coat and under the influence of sympathetic system. So guys, anyways, just look at this. There is simple shunt. Okay, where will you see all this will be usually end part of your body. Okay, so what are they talking about? Nose, lips, okay, ear, then erectile tissue of sexual organs, coccygeal body. So just remember towards the end everything. Okay, they're saying. Then you have specialized, like for nail beds, you have some specialized anastomosis between the arteries and veins. Then you have some preferential thoroughfare channels. Okay. You can just read more about this. We're not going into that. Remember, this is an anastomosis we're talking about. It's called as a shunt. So what is this? So if you have a nail, so this is your finger, here is your nail. Inside nail bed, they are saying there is this anastomose that will be there between your arteries and veins, right? So basically what they are saying is this is what? Anastomosis. It's also called as a shunt. But when the doctor themselves create it, right? So let us say the person needs dialysis, right? So they will create one in the hand like this, in the forearm. They will create a link between your artery and vein. The doctor is creating. This is called as a fistula. What is this called as? AV fistula. Okay, so don't get confused here. Here they are asking about shunt. This is anastomosis or shunt. Okay. This one which the doctor created is AV fistula for dialysis. Okay, you got it right. So what are three types of anastomosis with suitable examples? Quickly you can say now for 3 marks in 3 minutes. Anastomosis is communication between neighboring blood vessels. Okay, so it creates a collateral circulation. So we have 3 types here: arterial, venous and arteriovenous. Now when you say arterial, so basically the example that you will give are the palmar arch, plantar arch, circle of Willis in the brain, etc. Then you can talk about the coronary arteries which have anastomosis. Then in the brain also the cerebral arteries have some anastomosis. These are actually between the terminal arterioles. Okay. Then venous anastomosis, where will you see? Venous anastomosis, that is between the veins. Again, you have to talk about the hand and foot only. Venous anastomosis in the dorsal venous arch of hand and foot. Then coming to arteriovenous anastomosis, that is also called as shunt. Where will you see shunts? You will see it example in nail bed. Okay. Guys, there's one more point that you should know. An artery which does not anastomose with its neighbor is called as end artery. Okay. So example you have in the eye, retina. Okay. Then in the internal ear you have, then some other, but these are the best and absolute examples of end artery. Okay. So they don't anastomose. So if some blockage is there in them, then it will be like deadly type of thing. I mean, it will be bad. So central artery of retina, internal ear, excellent examples for absolute end arteries. Okay.